right, welcome to our deep dive on a real troublemaker in the microlab, Nocardia farcinica. Today, we're breaking down a report we put together using a Gemini deep search. And hey, if you're on the bench, you absolutely need to know this bug. Just a heads up, you can find all the sources we used in the notebook document that goes with this.
Okay, so this quote, it just nails it, doesn't it? This really gets to the core of why Nocardia farcinica is such a big deal. We're talking about an organism that's not just highly virulent, but it also comes preloaded with a scary amount of antimicrobial resistance. That combo is exactly what makes it a major challenge.
So for us in the lab, this is where it all begins, right? Getting the ID correct is step one, and it's absolutely critical. Let's walk through the whole diagnostic journey for Nocardia, from the moment that specimen hits the bench to the final report that's going to guide the clinicians.
You know, what's really cool is how these steps all fit together like a puzzle. It's a process, right? You start with those first clues under the scope, then you've got the, let's be honest, pretty slow process of culturing and running biochem tests. And finally, you get to the definitive answer, the gold standard, molecular confirmation. Each piece builds on the one before it until you have the full picture.
All right, this table is basically your cheat sheet for the classic clues you're going to see on the bench. First up, the gram stain. You got to look for those fine, beaded, branching filaments. They're a huge giveaway. And remember, this thing is a super slow grower, so you have to be patient. We're talking about holding those plates for at least 2 weeks. And oh yeah, that smell, that musty, earthy, potting soil odor, once you've smelled it, you never forget it. It's a dead giveaway. Okay, so even though we've all got these fancy molecular tools now, you can't sleep on the classic biochemical tests. They're still super useful for a presumptive ID. A couple of key things to look for. It's catalase positive, for sure. But the big one is its ability to grow at 45 degrees Celsius. That's a huge differentiator from other Nocardia species. And just as a final check, it's typically negative on the hydrolysis tests for casein, tyrosine, and xanthine. Now, let's talk molecular. MALDI-TOF is amazing, right? It's so fast. But, and this is a huge but, when it comes to Nocardia, its accuracy is completely at the mercy of its reference database. If you get a low confidence score, you just can't trust it. So the bottom line is this. If that MALDI result is anything less than stellar, you absolutely, positively have to confirm it with 16S rRNA gene sequencing. No shortcut.
All right, so let's shift gears a bit. We've talked about the lab work, but why is all this so important? Let's look at the patient side of things. Getting the ID for Nocardia farcinica right isn't just an academic exercise. It's critical, because this organism causes some really severe diseases, especially in the patients who are already the most vulnerable.
So here's what makes this bug so frightening. It's not just a lung infection. It loves to spread, to disseminate, and its favorite target, the brain. That's what makes it so dangerous. When it gets to the central nervous system and causes brain abscesses, well, that's a full-blown medical emergency. We're talking mortality rates as high as 80% in immunocompromised patients. Just think about that.
So, who's most at risk? Well, if you look at this list, you'll see a common theme. It's all about a weakened immune system, specifically compromised T-cell mediated immunity. This is, without a doubt, an opportunistic infection. It preys on people who are already fighting something else, whether it's from a transplant, long-term steroid use, cancer, or HIV.
And this is where we get to the real dilemma, for us in the lab and for the doctors treating the patient. How do you treat this thing? Because Nocardia farcinica comes with this built-in, formidable resistance profile. It makes our job, getting that ID and susceptibility right, absolutely essential for patient survival.
So, that's the million-dollar question, isn't it? How do we treat this? You can't just guess. Going with empirical therapy is incredibly risky, because if you pick the wrong drug, you're looking at treatment failure. The answer has to come from us, from the lab. It has to be based on solid identification and actual susceptibility testing. Okay, if you remember one thing about its resistance profile, let it be this. Nocardia farcinica is almost always resistant to third-gen cephalosporins. Think about that. A drug like ceftriaxone, which is a go-to for so many infections, is pretty much guaranteed to fail here. That's a piece of information that clinicians desperately need to know, and fast. So how do we interpret the results? For those of us in the US and in many other parts of the world, our playbook is the CLSI M62 document. That's from the Clinical and Laboratory Standards Institute. The biggest takeaway here, honestly, is that running susceptibility testing isn't just a good idea, it's mandatory. For any clinically significant Nocardia isolate, you have to do the AST.
Now, for our colleagues in Europe, this gets tricky. And this is a really important point. EUCAST, that's the European Committee on Antimicrobial Susceptibility Testing, hasn't actually published clinical breakpoints for Nocardia species. This creates a huge headache, right? It means labs over there have to rely on other standards, like CLSI, and that can lead to some real inconsistencies in how results are reported and interpreted.
And that variability leads us to this, a really interesting comparison between different treatment guidelines. On one hand, you've got the Dutch swab guidelines, which might suggest using TMP-SMX alone for uncomplicated cases. But, and listen closely, that approach is a non-starter for Nocardia farcinica. It's just not going to work because of the resistance. On the other hand, you have international guidelines, like from the IDSA, which call for what's really needed: aggressive combination therapy, and making sure that therapy is tailored to the actual AST results.
And if you think that's complicated, it gets even tougher when the patient is a child. Treating kids adds a whole other layer of complexity. As you can see, the dosing is totally different. It's all based on weight, and you have to be incredibly careful with the calculations. A big reason for this is that most of this data is just extrapolated from adults. For the heavy hitter drugs like linezolid and amikacin, you're almost certainly going to need therapeutic drug monitoring to make sure you're getting it right.
Okay, let's wrap this up by talking about infection control. Most of the time people pick this up from the environment, from soil or dust. But we can't forget that it can spread within the hospital. It might be rare, but nosocomial transmission is a documented risk, and it's something we have to be ready for.
So what's the key takeaway for prevention? It really boils down to controlling the environment. Think about hospital construction or renovation. That's a massive risk factor. All that dust gets kicked up, aerosolizing spores and putting our most vulnerable patients right in harm's way. This means infection prevention teams have to be working hand in glove with the folks in facilities management. It's absolutely essential.
So I want to leave you with one final thought to chew on. We know this is an opportunistic pathogen, right? So what if you diagnose invasive Nocardia farcinica in a patient who seems perfectly healthy? Should that diagnosis be a red flag? Should it automatically trigger a full workup of their immune system? It's a fascinating question because it just might be the first sign that uncovers a hidden immune deficiency. And that's our deep dive on Nocardia farcinica. We really hope this explainer is a useful tool for you, whether you're on the bench trying to ID this thing or talking through a tough case with the clinical team. Hey, if you found this valuable, do us a favor and subscribe to the channel. And we really want to hear from you. What are your experiences with this organism? Drop your stories and thoughts in the comments below. Thanks for tuning in.